guys, and welcome back to my channel Medicide. Our today's topic is encephalitis. It is the inflammation of the brain. Encephalitis with meningitis is known as meningoencephalitis, while encephalitis with involvement of spinal cord is known as encephalomyelitis. The word encephalitis is from ancient Greek encephalos, that is brain, composed of two words, that is in and kephal mean head, and the medical suffix itis means inflammation. Epidemiology. The number of new cases a year of acute encephalitis in Western countries is 7.4 cases per 100,000 people per year. In tropical countries, the incidence is 6.34 per 100,000 people per year. Causes. There are several causes of encephalitis, which includes viral cause. These include herpes simplex virus, rabies virus, polio virus, and measles virus. The most common identifiable cause of viral encephalitis is from herpes simplex infection. Herpes simplex encephalitis has an incidence of 2 to 4 per million of the population per year. Bacterial and other causes. Encephalitis can be caused by bacteria such as bacterial meningitis, or may be a complication of infectious disease syphilis, that is secondary encephalitis. Certain parasitic or protozoal infestations such as toxoplasmosis, malaria, which is caused by biting of mosquitoes, or primary amoebic meningoencephalitis can also cause encephalitis in people with immunocompromised systems. Lyme disease or Bartonella hanseli may also cause encephalitis. Other bacterial pathogens like mycoplasma and those causing rickettsial disease cause inflammation of the meninges and consequently encephalitis. A non-infectious cause include acute disseminated encephalitis, which is demyelinated. Limbic encephalitis. Autoimmune encephalitis, antibody-mediated anti-N-methyl-D aspartate receptor encephalitis, and Ramucin encephalitis are the examples of autoimmune encephalitis. Anti-NMDA receptor encephalitis is the most common autoimmune form and is accompanied by ovarian teratoma in 58% of affected women 18 to 45 years of age. Encephalitis lethargica. The cause of encephalitis lethargica is not currently known. From year 1917 to 1928, an epidemic of encephalitis lethargica occurred worldwide. Signs and symptoms. Adults with encephalitis present with some of the symptoms that include acute onset of fever, headache, confusion, and sometimes seizure. Younger children or infants may present with symptoms of irritability, poor appetite, and fever. Neurological examination usually reveals a drowsy or confused person, stiff neck due to the irritation of the meninges covering the brain, indicates that the patient has either meningitis or meningoencephalitis. In case of limbic encephalitis, patient presents with disorientation, disinhibition, memory loss, seizures, and behavioral anomalies. Autoimmune encephalitis signs include catatonia, psychosis, abnormal movements, and autonomic dysregulation. Encephalitis lethargica is identified by high fever, headache, delayed physical response, and lethargy. Individuals can exhibit upper body weakness, muscular pains and tremors, and others. Complications of this disease include seizure, trouble speaking, memory problems, hearing problems, and others. Diagnosis: people should only be diagnosed with encephalitis if they have a decreased or altered level of consciousness, lethargy, or personality change for at least 24 hours without any other explainable cause. Diagnosis can be done by MRI, which determine inflammation and differentiate from other possible causes. EEG for monitoring brain activity. Encephalitis will produce abnormal signal. Other tests include lumbar puncture, which is also known as spinal tap, blood test, urine analysis, polymerase chain reaction or PCR, testing of the CSF or cerebrospinal fluid to detect the presence of viral DNA, which is a sign of viral encephalitis. Treatment includes the supportive care, antiviral medications if the virus is cause, antibiotics if bacteria is the cause. Steroids are used to reduce brain swelling, sedatives for restlessness, acetaminophen for fever, occupational and physical therapy if brain is affected post-infection. Pyrimethamine-based maintenance therapy is often used to treat toxoplasmic encephalitis, which is caused by Toxoplasma gondii. Duration: it takes weeks to months for recovery. Prognosis: prognosis is variable. Identification of poor prognostic factors include cerebral edema, status epilepticus, and thrombocytopenia, which means the decrease of the platelet count in the blood. In contrast, a normal encephalogram at the early stages of a diagnosis is associated with high rates of survival. Death rate is approximately 13,600 to 20,400 deaths worldwide each year. Prevention: vaccination is available against tick-borne and Japanese encephalitis and should be considered for at-risk individuals. Contraindication: contraindication to pertussis immunization should be observed in patients with encephalitis.